I'm Roger Bloomer. I practice family medicine for over 10 years. Currently, I treat chronic wounds and other wound conditions, sometimes utilizing hyperbaric oxygen therapy in appropriate wounds. The hyperbaric chamber works primarily by having the patient breathe oxygen inside a pressurized chamber. By breathing the oxygen within the pressurized chamber, small oxygen bubbles are placed into the serum or liquid part of the blood, which ordinarily you can only carry the oxygen on your red blood cells. And by getting that extra oxygen to the wound, it allows it to heal more efficiently and faster. At the wound care center, I often see diabetic foot ulcers, venous stasis ulcers, sometimes radiation injuries, sometimes surgical wounds. And some of the wounds are infected, some are not. Some of them are related to peripheral arterial disease. It's very rewarding trying to heal wounds that are very chronic, and sometimes patients have had them for months or years and have not been successful in healing them. In wound care, we have a smaller group of patients than primary care, often less quantity, which allows us to get to know the patients better. Often the patients are returning week after week for wound care, so we get to know each other very well, which is kind of a neat relationship. Somewhat similar to family medicine, but I think it's family medicine, you often see your patients, a few times a year, but in wound care, you see them at least a few times per month. So I think there's a special connection that you form with your patients because you see each other so often for that time that they need the wound care. The reason I primarily practice in the Jackson area, I grew up about 35 minutes or 35 miles south of Jackson in the small town of Hudson. And so basically staying near home.